I'm going to start with my Iowa constituent. Last year, 29 Iowa pharmacies closed, many of which were in rural areas and have served their communities for decades. You own a small group of rural pharmacies and recently had to close some. What legislation would you like to see Congress pass to help rural pharmacists like yourself and the patients you serve? And since bureaucracy can work faster than Congress, is there anything that HHS can be doing that would help along this line?
Senator Grassley, I appreciate the question. Before answering your question, I do have a couple of points. One is I want to be clear that pharmacy deserts occur not only in rural areas but also urban areas, negatively affecting the care of our most vulnerable patients. The second point is that community pharmacy is much more than just a place where prescriptions are filled. It's a place where patients have access to a trusted healthcare partner. It's a place where patients receive healthcare services ranging from medication management, point-of-care testing and immunizations to health promotion and chronic disease management. It's a place where care coordination and medication management service help patients achieve optimal outcomes. And it's a place where pharmacists and their staff work closely and collaboratively with physicians, other providers, and community-based organizations to optimize patient care. To answer the question, as far as the first part of your question and legislation, I think a good place to start is your Bill S-526, the PBM Transparency Act, where it bans PBM deceptive and unfair pricing schemes, prohibits PBM clawbacks of payments that have been made to pharmacies, and improves transparency about spread pricing and pharmacy fees. Next, I'd like to address the fair reimbursement to community pharmacies and Medicare Part D. Senate Bill 5, or S-882, the Patients Before Middlemen Act, and enhances the PBM transparency and accountability to reduce prescription costs for seniors. Also ensures all treatments are fair treatment for all pharmacies as it relates to Medicare Part D contracts. But what's missing is, again, addressing reasonable and relevant Part D reimbursement from CMS to make pharmacies whole. Lastly, I talked about the services that we provide beyond prescription dispensing. I do think we have to develop some kind of a payment model for those services that is having impact not only on patient clinical outcomes, but also on total cost of care. Your second part of your question is about HHS and what they could do. And is it possible to provide authority for the Secretary of HHS to fix Medicare Part D payments for community pharmacies to ensure fair and reasonable reimbursement so we can continue to provide care to our senior patients?
Thank you.